presentation, we're going to talk about the opioid epidemic in the United States and why it has major effects in the U.S. Has anyone ever been prescribed opioids in here? Yep. It's common when you go to the doctor if you have surgeries and such, and both of us have had surgeries where we've been prescribed opioids. In the United States, more than 130 people die from an overdose on opioids every day. This is a national crisis that affects public, social, and economic health. The National Institute on Drug Abuse states that the Midwestern region saw a 70% increase in opioid overdose from July 2016 through September 2017. This is an issue happening right here in Fargo. And in North Dakota, 50% of the prescription drugs given out are opioids. It's not something that should be overlooked because of the beliefs that it doesn't happen here, or if it doesn't happen to me, then it's not my problem. Opioid abuse and addiction need to be addressed. There's a lot of effects from opioids, but some of the short-term effects include feelings of euphoria, pain relief, and drowsiness. Some side effects are paranoia, respiratory depression, and nausea. These drugs remain extremely addictive, sometimes causing measurable symptoms of addiction in under 3 days. And some of the long-term effects from opioids are constipation, liver damage, and brain damage.
Okay, now that Landon talked about our topic and about some background information, I'm going to talk about what caused this to be a problem. The earliest reference to opium growth and use goes back to 3,400 BC, according to the DEA Museum. And so they've always been around, but have came from a plant and haven't always been in a pill used for pain relief. This has only recently become a problem because in the 1990s, organizations of pain advocacy specialists expressed and voiced out that the U.S. was plagued with untreated pain, and a lot of people agreed and wanted people in pain obviously wanted that to be not painful, and so the prescriptions went up a lot. This caused the first wave of the opioid crisis, which began in 1991, when opioid-related deaths distinctly escalated following the increase of prescription opioids for pain. This wasn't intended for everyone to be addicted. Pharmaceuticals didn't believe that it was going to be addictive. In the U.S., the number of opioid prescriptions increased by 300% from 1991 to 2009, according to Alexander Pappas-Diop. And in 2009, the U.S. consumed 99% of the world's hydrocodone. And the more the prescriptions were prescribed, the more opioid-related deaths increased. Obviously, not good, big problem. We talked about that. Today, the problem still progresses on. It's the leading cause. Drug overdose is the leading cause of accidental death in the United States. It's very clear that this is bad, and it shouldn't take it as far as it's taken to be recognized. It shouldn't have taken this long for steps to be taken about it. So I believe a solution would be to create a system followed by all physicians in the United States. It can start right here in Fargo, branch out, but it would be only small amounts of prescriptions would be filled. It's unnecessary to have a 30-day, it's unnecessary to have a 30-day prescription for a minor procedure. And then a lot of times cancer patients and patients with diseases that are long-term and associated with like chronic pain will be on these medications for a long time. And with that, the system would integrate monthly checkups to decrease addiction, and it would also be less focused on inpatient hospital settings because it's very unlikely for prescription painkillers to be not prescribed after big operations and stuff like that, but the system should begin once they're discharged from the hospital.
Another solution is having prescription medicine disposal, so drop boxes to safely dispose of your old medications. There's 27 locations in the Fargo area, and there's at least one in every county in North Dakota. This can help to just keep the cupboard clean and to prevent them from getting into the wrong hands. According to the CDC, more than 80% of people who misuse prescription pain medications are using drugs prescribed to someone else. And then another solution is limiting the opioids prescribed, like Kaylee had talked about. In states such as Arizona, North Carolina, and New Jersey, they all passed laws to limit the initial prescription to 5 days maximum, and Nevada is the only state with a 14-day prescription limit. Okay, so in summary, the problem is people are dying. There's 130 deaths in the U.S. every day. There's been a spike in the Midwestern states, 70% increase in the opioid overdoses in the Midwest in like last year, and the long-term effects like constipation for lasting over 48 hours, liver damage, and brain damage.
We also talked about the cause, how it wasn't the addiction and overdoses were an unintended consequence, but they still need to be dealt with. And then we talked about some solutions on how to kick this in the butt because it's not good, such as limiting prescriptions and drop boxes.
So let's clean up our cupboards, and not just with a duster.